Here is our host, Tian Wei.
Hello and welcome to World Insight with me, Tian Wei. The WHO declared that COVID no longer represents a public health emergency. The WHO Emergency Committee notes that COVID deaths and hospitalizations have declined while immunity to COVID, either through vaccinations or infections, have risen. But WHO Director General Tedros cautions that COVID still claims a life every 3 minutes and still constitutes a public health threat. So how should we look at the WHO declaration? What have we learned over the past 3 years together? I speak to Margaret Harris, an epidemiologist and WHO spokesperson, to find out more. Margaret, good to see you.
And you. It's great to be together again.
What does that mean, this specific important announcement?
So what this means is that the acute phase of the emergency is over. And it does not mean, the important thing to understand is it does not mean that COVID no longer presents a threat. COVID still is very much a threat to human health all around the world. But why they said that the emergency phase is over and the Director General accepted this advice was for several reasons: that the number of hospitalizations, the number of people in intensive care has dropped, the death rate has dropped, and also the world has become much better at looking at where the virus is, understanding the variants, which don't seem to be associated with increased severity, thanks to the extraordinary work to get vaccines developed and then to get the vaccines into people's arms. And of course, many, many people have also been infected by the virus itself, have been exposed. So those two things have built up a strong level of immunity in populations around the world.
As a result of this announcement made by the Director General, how do you see the approaches taken by governments around the world have been changing?
Well, it is a concern that, and this was happening before we lifted it actually, that some governments or some authorities have been removing the surveillance structures. That's removing the testing, removing the laboratory, the ability to test for the virus, and that's a really serious problem. This announcement means that COVID-19 is now an established and ongoing health issue, and although it no longer constitutes a public health emergency, and we even are looking at doing something we've never done before, which is to have an ongoing expert committee to continually review COVID-19, because this is a virus that has been unique, has posed an enormous threat to human health around the world. It's never happened in our lifetimes, in our generation, really in our history of public health. And so we need to do things differently, and we certainly should not let our guard down.
It's 3 years, really, as you said. It's like the whole global population has one collective memory. That is COVID-19. If people ask you, what should we remember from the past 3 years? What should be our reflections of the past 3 years in maybe 10 years' time? Is the answer going to be different?
I think, and I really hope, what we should remember is how good we were to each other, and how, when we were good to each other, that achieved great bounds in our overcoming the virus. And by what I mean how good we were, when we shared information, when our scientists from every political hue, every part of the world got together, talked, shared information, developed those tools, not just the tools, but told each other, well, when I'm working in the hospital, if I turn the patient over, they survive better, or these are the early signs, these are the things to look for in somebody who's going to get a lot sicker, or these people will recover without having to go to hospital. All that sort of information, all that kind of support people gave each other, and even some of the things like the big concerts people held, the things people did to help each other stuck in their homes in those terrible, terrible, bleak bleak weeks and months for some people of lockdown, those I would like to say we remember that there was some really, really great, there was so much great goodness that showed why humans, when they're good, they're great.
There were also moments and myths about the pandemic that we have not apparently resolved, whether vaccines were shared equally around the world, whether those global platforms for vaccines and also seeking solutions actually have been as useful as it should be, and also whether we are seeing science is being understood with subtlety and thoroughly, and meanwhile, whether there is really concrete studies about how vaccines and therapeutic treatments worked or will work in the future. How are we going to digest those?
Those are very important questions too. And you're certainly right. We saw a massive rise in misinformation. And again, we are going to need as the world to work together to understand how we combat misinformation. A lot of it is passed by people who don't even realize they're doing the wrong thing, that they're not deliberately sending a negative story or an incorrect story around, but it's been presented to them in such a way that they think it's something truthful and they send off to all their friends and relatives and so on. So that is critical, and helping people, and this may require that our youngest members of our population, our children, learn from a very young age how to distinguish between accurate information and misinformation, because they are bombarded with material from social media. So that is a huge area of work, and we actually developed a large team dealing with misinformation and disinformation during the COVID-19 pandemic, and they certainly worked hard, but they also know there's much more we need to understand and learn how to do. And the other issue you raised was a very important lesson that we that we need to learn and we have to do better. We set up a structure, countries around the world agreed to it. We set up a structure for fair distribution of the vaccines and therapeutics and equipment. But when the vaccines became available, the countries with the greatest resources snapped them all up, and there was nothing for at least a year to get to the countries with fewest resources. And we still don't have high enough levels of vaccination in many countries, in many low resource countries. We're, of course, working very hard to get those people vaccinated. But this is not, I'd almost call it a no-brainer. If you've got a threat, and if there are certain groups at most at threat, you need to vaccinate those groups first all around the world at the same time. But unfortunately, self-interest, whether political or whatever, got in the way, and countries were vaccinating their entire population before the highest risk populations were vaccinated in other countries. And that's another reason for developing the pandemic accord, again, having an agreement with all countries that when you've got a situation where you've got certain groups that need to be vaccinated first around the world, we will actually do it next time.
We have seen the world ever more manipulated by rhetorics rather than real information, manipulated by fake news rather than good quality service of news. So how do you see, as a communication person of World Health Organization, this trend, and also what do you think is the way out? What have you tested in terms of the toolkits during the pandemic past 3 years?
I'd say two things are critical. First is trust. If you are not trusted, people will not take what you say and act upon it. And if, unfortunately, a group or an organization that wishes to present disinformation has somehow achieved the trust of their viewers, then they will follow that. So it's critical to look at how you can build trust. many ways, of course, if your information remains accurate, or also if you're honest when your information does change, when what you know is different from what you thought you know, you must acknowledge that, the science has moved, the science has evolved. And we found that throughout this pandemic, there were moments where the things that seemed to be accurate or appropriate early on had changed. And it was very, very important to inform people of those changes and why those changes were being made. The other thing is your information needs to be acted on. It's no good for me to tell people to wear masks if there are no masks if it's not possible for them to get masks, or if I say get vaccinated tomorrow if there are no vaccines in the country. So it is absolutely critical, and this is one of the hard things for communicators because we're talkers. It's actually critical that your communication is in step with what is possible for the people you are speaking to, so that they can actually act on the good advice and do the things needed to protect their health.
As fragmented the world as it is, Margaret, what efforts do you think WHO and its member economies and countries have to work on in order to get that deal done?
WHO has now reached its 75th birthday, and we were sort of looking back at why we were set up. We were set up at a time when the world was also fragmented, just after the Second World War, which caused tremendous loss and suffering and fragmentation around the world, but particularly in Asia and in Europe. And the purpose of an organization like ours is to be neutral, is for all countries to have equal status, equal rights, and to neutrally come together to do what is right for the health of the world. And having worked even during this difficult period, I do believe that's possible, as long as countries can put their politics aside and understand that health doesn't recognize borders. It doesn't recognize politics. Viruses don't care which party you vote for or what your ideological beliefs are. They'll kill us all if we don't work together.
We have been talking to each other over the past 3 years, and certainly you and your organization have been working very hard with your counterparts in China, whether they are individual scientists, researchers, or organizations of transmitted diseases.
Oh, goodness, there were so many moments. But I must say, for me, the moment I felt goosebumps, and I still do, was in February. So this was less than a month, just a first month, February 2020. And we brought together all the scientists from around the world to ask what were the main priorities. What should we really put our energy, our funding? We had the funders in the room, to understand what was going here, so that we could develop tools very quickly, including vaccines, but treatments, but also just to simply understand what was going on with this virus. And it was the Chinese scientists who were calling in. This was in Geneva time. We were still all in a big room in those days. It was before we all got locked down and did everything virtually. But of course, our Chinese colleagues had to call in because they were in the middle of working. They were at bedsides. They were calling in from hospitals that were overwhelmed with this new disease. And they shared everything. They shared the advice, their experience. And this really helped everybody to understand at the moment. So whenever I talk about what I saw the scientists do, I always remember that day thinking, these guys must be exhausted. And yet they've taken the time wherever they are to get on the call and share with everybody else, because this was critical that we as the world came together and looked for the answers and developed the tools as quickly as possible.
What a 3 years that we are experiencing together. I'm sure it will have its mark in the contemporary history. And I'm sure people will reflect upon those 3 years with a lot of food for thoughts. Thank you, Margaret, for the contribution you have been making, both on our program and certainly through other channels as well.